So for this portion of the video, we're going to demonstrate the examination of the nose and the mouth and oral cavity. So the first part for the nose, we want to inspect the external nose. We want to make sure that it's straight in the midline, it's not deviated to one direction or the other. Again, looking for swelling and redness. Next, we want to evaluate for nasal patency. So I'm going to ask you to close one side of your nose for me with your finger and inhale. All right, now do the same thing on the other side. Okay. So I recommend you do that with inhaling to make sure that air is flowing through both sides. I recommend you don't have them do a sharp exhale because again, that could have some minor unfortunate consequences. So we also want to be able to examine the inside of the nasal cavity. So for this, we typically use the otoscope because it's available. There is a nasoscope, but most offices don't have one easily available. So you want to use a fresh speculum and make sure you attach it to the otoscope in the same manner that you would for the ear exam. All right. So for this, what I'm going to do is ask you to tilt your head back just slightly for me and then put a little bit of traction on the tip of the nose to open up each nair. Then what I'm going to do is I'd recommend that you anchor your finger on the patient's face because again, you don't want to have a whole lot of pressure of the otoscope on his nose. And then gently insert the otoscope just enough to be past the nasal hairs and then examine the septum and the turbinates. Now he's breathing while you're doing this, so you either need to ask him to hold his breath or be quick so you don't fog the lens of the otoscope. So I'm going to do the other nair in the same pathway. I brace my finger on his face, insert past the hair, and quickly examine the septum and the nasal turbinates. Again, looking for areas of redness or swelling. So again, at this point, you would remove the speculum and discard it. For the inspection of the oral cavity, you need a light source. If you've got the otoscope available for you, you use that. If you don't, a pen light is just as sufficient. You also need to be able to examine the whole You also need to be able to examine the whole oral cavity, so you need an instrument to be able to move the lips away from the teeth and the gums. So typically a fresh, clean tongue blade. So what I'm going to start by doing is ask you to open up your mouth, and I'm going to move your cheek away from your teeth so that I can look all the way around, both anteriorly and posteriorly, but also both the upper and lower teeth, looking at the mucosa all the way around. Now, if you could open up your mouth and touch your tongue to the roof of your mouth. And I've examined the mucosa underneath the tongue. Okay. So now we want to be able to evaluate the posterior pharynx. So you ask the patient to open their mouth and look to see how much of the posterior pharynx you can see. If the tongue is in the way, you'll want to use the tongue blade to gently push down on the tongue. Do your best not to gag the patient, but occasionally it's not something you can avoid. So if you could open up your mouth and say ah for me, this raises up the uvula, and then gently press down on the tongue until I can see the posterior wall as well as the area where the tonsils exist.